As we move closer towards the May 20th reopening, predictive models by Hartford HealthCare and MIT show a death count that will unfortunately keep on rising. Listen to this.
I think the range is going to be somewhere between 3,500 to 7,000. That's the range we're looking into. I hate to say this way, but we could exceed 4,000 by early June at this time with the speed we are going right now.
Let's bring in Hartford HealthCare President and CEO, our pal Jeff Flaks. Hey, Jeff, all along the medical experts have urged caution and the need to continue social distancing. With May 20th on the horizon, do you think that might be too soon?
Well, Tom, first let me begin by saying good morning and happy Mother's Day. Look, we've been working very closely with the governor's team and the governor in particular. I think the state's taken great precautions. And we are seeing today in studies we're doing with antibody testing, in some of the studies we're doing even around the viral testing, that all of the social distancing that we've put in place really is working. And I think it's just critical as we start to take very measured approaches and gradually start to advance to restarting the state in different ways, that we do it with great caution, significant testing, and that we look and monitor and measure our data routinely, almost daily, so that we can stay on top of this as we go forward.
Governor.
Hey, good morning, Jeff. No, that's well said. I can't emphasize enough. I heard that prediction. Right now, obviously, our fatalities are going down and our ICU capacity is going up. Jeff and I were there cheering on the nurses just a few days ago. It was amazing what those people are doing. But number 1, 2, and 3, I think, is continue to wear the mask and maintain the discipline. If we do that, I think we can continue to see these lines going down, and that allows us to open very cautiously. And as Jeff said, if the facts on the ground change, we can change the throttle a bit, too.
Morning, Jeff. It's Roy Occhio-Grosso. Thanks for being here this morning. Question for you. What's morale like inside Hartford HealthCare? The folks who work inside there on the front lines and exposing themselves to danger every day. What's morale like?
So the governor was with me. We walked the floors together. We met with doctors and nurses and people providing environmental services and food services and members of our biomedical engineering teams. I have to tell you, Roy, the resiliency of healthcare workers is absolutely awe-inspiring. It's incredible to see what they're working through, these challenges today, how they've had to change their practices, and the nature of what it's like on the first line. I mean, at one level, there's great distress because of the seriousness and intensity of the work they're doing. But at the other level, their sense of purpose, professionalism, and expertise, it shines through. So morale is actually very strong. There's amazing commitment. People were born to do this. People work in healthcare on the front lines. I often describe them, they're a special breed. And it really comes through. They're here to serve. This is their moment, and they really are rising. It's really impressive.
Hey, Jeff, I know the governor has talked about testing on a daily basis. This is for both the governor and for Jeff. How do we get more testing to the urban areas and to the communities that need it the most?
So, Tom, fortunately, we're doing it.
I'll start with that if you want, Tom.
Testing now.
Go ahead, Governor. Go ahead, Governor.
I was just going to reiterate, there I was with Jeff, and one of the things we found is, A, Hartford Health has the mobile testing lab, so we're taking the tests and the collections right to the communities, those underserved communities where people are most likely to be infected, and those communities where most people are most likely to have some complications. And as Jeff and I were talking about just the other day, we actually have a little extra capacity now. And that's because some people are a little cautious about wanting to be tested and what the results may be. It may mean you have to quarantine for a period of time. So we have to do a better job of urging everybody it's the right thing to do to get yourself tested, just like wearing a mask. It protects you and it protects the broader community.
Hartford HealthCare President CEO Jeff Flaks, thanks for joining us on Capitol Report.